Good morning, my name is Dr Anne Drake. I'm the Director of Nursing, Quality and Patient Safety at Letterkenny University Hospital. We are delighted at Letterkenny University Hospital to work in collaboration with our community healthcare colleagues in Cavan, Donegal, Leitrim, Monaghan and Sligo with this important initiative to raise the profile of menopause in our workplace. Letterkenny University Hospital has a workforce made up of over 75% female employees, so it is essential that we ensure the health and well-being of all women is catered for. In recent years, there has been some phenomenal work throughout the country in the area of menopause and its impact on the workplace. So by benchmarking ourselves against top achieving staff health and well-being services in Ireland and worldwide, we will be able to expand the supports available to staff here at Letterkenny University Hospital and ultimately increase overall staff health and well-being. I fully endorse these educational videos and hope the staff here at Letterkenny University Hospital and our colleagues in the community find the information provided of real value.
My name is Dara Dunne. I'm a pelvic health physiotherapist with a special interest in women's health physiotherapy. In this presentation, I will explain the role of the women's health physiotherapist, the common issues women present with when going through menopause, the impact hormonal changes have on the pelvic floor, bladder, bowel and bone health, and the practical tips which will help you to manage the symptoms of menopause. Please do note this is general information and you should contact your own GP to discuss any specific issues. A women's health physiotherapist has undergone extensive postgraduate training in the specialist area of obstetrics and gynecology. Women's health physiotherapy is the treatment of all disorders affecting the pelvis, pelvic organs and the pelvic floor. Education forms a significant part of our role whereby we support, empower and educate women on how to implement changes to best support a healthy, active lifestyle. So it is natural and normal for hormone levels to fluctuate during a woman's lifetime. This diagram depicts the fluctuations that occur. From birth to puberty, we have relatively low levels of reproductive hormones. Puberty brings a roller coaster of experiences as our body adjusts to the ups and downs and ultimately higher hormonal levels. Next comes the fertile years. During this phase, most women find their hormones settle into a pattern and become more predictable. Perimenopause starts for most women in their 40s. It is the time the body makes the transition into menopause. During perimenopause, the predictability of your hormones change. You may still menstruate, but your cycles may be closer together or further apart. Ultimately, it is the reverse of puberty. Your body is readjusting to the lower levels of hormones. Once again, it can be a roller coaster of ups and downs. The average age of menopause is 51. It occurs when periods have been absent for 12 months. Once this has occurred, you enter into postmenopause. This reduction in reproductive hormones during perimenopause and menopause can lead to changes which impact the bladder and bowel. This slide shows the most common symptoms. The bladder symptoms are grouped to the left, such as frequency, urgency, stress incontinence, urge incontinence or overactive bladder, and urinary tract infections. We will discuss these later in more detail in the presentation. We have pelvic organ prolapse in the centre, and then on the right there is bowel urgency and incontinence, constipation and poor wind control. Other symptoms women can experience due to lower levels of estrogen are a collection of symptoms known as the genitourinary syndrome of menopause. These include vaginal and vulvar tissue dryness, dry itchy skin, painful intercourse and burning with emptying the bladder and urinary incontinence. Dumoulin in 2019 in a study called Keeping the Pelvic Floor Healthy describes how we have the direct impact of menopause and aging on the pelvic floor, leading to a reduction in that elasticity in the muscles of the pelvic floor, which means that once a force is exerted on the pelvic floor itself, it is more difficult for it to recover. Forces we exert on the pelvic floor every day are, for example, the cough, sneeze, lift, run, jump. Pelvic floor muscles, just like all skeletal muscles, change with age. Between the ages of 40 and 80, women lose 30 to 50% of their muscle mass. If we think about this for a moment, 50% loss of muscle mass. Think about the impact this will have on your physical well-being. Obviously, These changes in elasticity, muscle mass and strength directly impact the pelvic floor and its ability to function well. This slide explains the external factors which can impact the pelvic floor, conditions which often coincide with and are exacerbated by menopause. In the picture on the top right, we see a cross-section of the pelvis, internal organs and the pelvic floor. As you can imagine, any pressure from above is going to put pressure on the pelvic organs and the pelvic floor itself. With menopause, there is an increased risk of weight gain, in particular an increase in weight around our middle or our abdominal area. This in turn increases pressure on the bladder, weakens the pelvic floor and increases the risk of urinary incontinence and pelvic organ prolapse. Similarly, chronic coughing, whether through disease affecting the lungs such as asthma and COPD, or on account of smoking, will obviously increase abdominal pressure. And menopause is a time when bowel activity slows down, and this can lead to constipation. Constipation increases the risk of urinary incontinence and prolapse due to straining, and interestingly is also associated with an increased likelihood of surgery to correct prolapse. In diabetes, there is a risk of nerve damage with obvious impact on nerve supply to the bladder and bowel. And finally, the genitourinary syndrome of menopause, causing vaginal dryness and discomfort, which in turn can then impair voluntary relaxation of the pelvic floor. This leads to greater friction of the tissues, whether with walking, general movement, or during sexual activity. Lifestyle modifications are the everyday changes we need to make to help us to manage these external factors to allow us to lead as healthy a lifestyle as possible in the menopausal years. For example, through healthy diet and exercise, we can maintain a healthy weight. A weight loss of 8% if overweight can improve stress urinary incontinence symptoms by up to 50%. Exercise does not need to be complicated or expensive. The more straightforward it is, the more likely we are to continue. And it has been shown that if we can exercise with a friend or in company, we're more likely to continue. Chronic coughing needs medical management, and in the case of smokers, it's important to take that leap and to quit. There is never a bad time to do it, and the HSE has excellent quit services to help. Diabetes needs to be well controlled and monitored to prevent nerve damage to the pelvic floor nerve supply, and this can be done in conjunction with your GP or your diabetic nurse specialist. Symptoms of genitourinary syndrome, such as painful intercourse, can be managed through the use of lubricants such as Yes and Silk. If using condoms, it's better to avoid oil-based lubricants. Vaginal moisturizers such as Replens help to restore moisture in the area, and this can be brought over the counter. Topical estrogens can be prescribed by your GP to help with vaginal atrophy and dryness. Again, quitting smoking is so important. We have research from as far back as 1996 that shows smoking increases the risk of vaginal atrophy and the symptoms of genitourinary syndrome of menopause. Constipation is defined as having less than 3 bowel motions per week. There are several simple things we can do which help to improve our bowel function. Firstly, a healthy diet, including fibre in the form of fruit and veg. The HSE's food pyramid, shown here on this slide, from 2016, shows that we need 5 to 7 servings of fruit and veg daily as part of our healthy diet. For the bowel to function well, we need to hydrate sufficiently. We need at least 1,500 ml of water daily, and this equates to about 8 to 10 glasses. It is important to avoid straining. Using a step under the feet to raise the knees higher than the hips can be helpful. A small step, known as the squatty potty, as seen in this slide, can be bought online. It helps us to simulate the squat position in order to allow the pelvic floor muscle to relax, and in turn helps the bowel to empty. To focus on incontinence for a moment, there are 2 types of incontinence, urinary and fecal. Urinary incontinence is defined by the International Continence Society as the involuntary loss of urine. There are 2 types of urinary incontinence, stress incontinence and urge incontinence. We have also mixed urinary incontinence with symptoms of both stress and urge occurring at the same time. Fecal incontinence is defined as the involuntary loss of stool. This can be stool or just soiling. It's also associated with urgency and poor wind control. And this slide will focus on urinary incontinence. Here we have both types of urinary incontinence so that we can easily compare the two. Stress incontinence is leaking on effort, for example, with coughing, sneezing, running, jumping. Urge incontinence, then on the right side of this slide, is this overwhelming urge to pass urine and not being able to make the bathroom on time. It's also known as overactive bladder. We can have the symptoms of overactive bladder without the incontinence. It's sometimes known as dry overactive bladder. The symptoms are urgency, this overwhelming need to pass urine, causing us to have to rush to the bathroom. There's frequency, which is passing urine more than what is normal, and it can be up to 15 times per day, severely impacting quality of life. Normal frequency is 5 to 6 times per day, and approximately every 3 hours between visits to the bathroom. Nocturia then is getting up to empty the bladder more than once in the night. We need to pay attention to what we drink on a daily basis in order to keep the bladder healthy. Drinks which we know to irritate the bladder are caffeine, fizzy drinks, juices, energy drinks, alcohol. Drinks which don't irritate the bladder are decaffeinated tea and coffee, but most importantly water. Once again, drinking 1.5 to 2 litres daily, which is 8 to 10 glasses per day, and avoiding fizzy water, which is known to be a bladder irritant. And again, if you get up to pee in the night time, avoid drinks for at least 2 hours before bedtime. We can retrain the bladder to do better. We can do this by following some tips and tricks which help get it under control. The main message, if you have overactive bladder and feel the urge, is to hang on. Avoid responding to every urge. We do this by several methods. Firstly, squeeze the pelvic floor muscles, and this is where we need a strong pelvic floor, and pelvic floor exercises may well be required to help us achieve this. I will discuss pelvic floor exercises in this presentation. Applying firm pressure to the pelvic floor, either by using your hands or sitting down or crossing your legs, can help. Curling your toes or rising up and down on tiptoe. This can also help due to the innervation from our leg muscles arising from the same area of the spine as the innervation to the bladder. Our body is not good at using a single part of the spinal cord for 2 purposes at the same time, and therefore these movements of the toes and legs can help dampen down impulses from the bladder. Distraction is very powerful. It takes our focus away from the bladder and helps us to hold on a little longer. Wait for the urge to pass. It takes about 10 to 20 seconds. Then you can either make your way to the bathroom under control or decide to hold on a little longer until the next urge arrives. It's important to be consistent in your efforts and avoid going to empty the bladder just in case, which is a habit that promotes the bladder to become more active. Gradually train yourself to hold on a little longer, bit by little bit. Pelvic organ prolapse is when one or more of the organs in the pelvis slip down from their normal position and bulge into the vagina. The first picture, top left, shows normal anatomy of the organs of the pelvis. The picture top right shows a bladder prolapse where the bladder has fallen against the vaginal wall and begins to protrude. Bottom left shows a prolapse of the back passage where the same thing happens, but now it is the back wall of the vagina that is protruding. Bottom right shows a prolapse of the uterus, and all or any one of these can happen to women on account of childbearing and the added impact of menopause and aging. In order to prevent pelvic organ prolapse, it is important to remember these following tips, some of which I have already discussed. Avoiding constipation, avoiding heavy lifting for the obvious reason of causing the added pressure on the organs and pelvic floor, maintaining a healthy weight and staying active, avoid smoking, again due to the effect of a chronic cough leading to stress on the pelvic floor. Manage allergies, so for example hay fever, and managing repeated sneezing, as this can stress the pelvic floor. Do pelvic floor exercises often. We're discussing these in the next slides. Low impact exercise such as walking, yoga, Pilates, light weights and swimming all help us to exercise without stressing the pelvic floor further. One of the principal roles of a women's health physiotherapist is to teach and guide women through the process of learning and carrying out pelvic floor exercises to help address the incontinence and prolapse problems I've discussed in this presentation. Pelvic floor exercises have been shown by research to be effective in preventing symptoms of stress incontinence and prolapse, and also helping to improve the symptoms of genitourinary syndrome of menopause. An important point to note is that the outcome of any pelvic floor exercise program is highly dependent on the level of user participation. In other words, it is entirely up to the individual to do the exercises as directed in order to get the best results. And don't forget about posture. This picture shows our pelvic floor like a hammock underneath the pelvis. Our pelvic floor does not work in isolation. It is part of our core, along with our abdominal muscles and the muscles of the spine, and even the diaphragm, which lies between our abdomen and our lungs. These muscles support the spine. The more upright we hold ourselves, the better these muscles will work, including our pelvic floor. So if doing pelvic floor exercises is sitting or standing, we need to remember holding tall, upright posture is important and will help our pelvic floor to function better. Pelvic floor exercises can also be done in lying, either on your back or lying on your side. These are the easiest positions in which to do the exercises. So whichever position you choose, make sure you're comfortable and do the exercises with me as I describe them. The first exercise is what we call a slow exercise. In this slide, you can see the pelvic floor, which forms the hammock at the bottom of the pelvis. Most of the muscle of the pelvic floor is around the back passage. We are now going to gently tighten the muscle at the back passage like we're trying to stop wind, and then tighten at the front like trying to stop passing urine. You hold for the count of 10, making sure to breathe normally and avoid holding your breath. When you reach 10 seconds, allow the pelvic floor to release. It's important that you're able to feel this release. If you can't feel the muscle release and let go, you may not be able to hold for that 10 seconds and you will need to shorten your hold. You will need to set your own baseline and work from there. Ideally, performing 10 repetitions of this exercise 3 times per day. Following the slow exercise, we do a fast exercise, which works on the fast twitch muscle fibers and helps the muscle to respond to those times when we cough, when we sneeze, lift or jump, and when we need the pelvic floor to react quickly. So it is the same exercise but performed more quickly. We do it gently, but the speed is important. So it's a quick on-off exercise, and again 10 repetitions 3 times per day. The knack is a strong and well-timed contraction of the pelvic floor muscles. It involves the pelvic floor muscles contracting immediately before and during an increase in downward pressure, for example with a cough or sneeze. This, of course, should happen automatically, but in stress incontinence we have lost this ability, and performing the knack helps to improve the bladder control and helps protect against pelvic organ prolapse. One of the most common mistakes in performing pelvic floor exercises is overworking, resulting in using the wrong muscles. To avoid this, pelvic floor exercises are performed with a gentle contraction, resulting in a more targeted and effective exercise. It is easy to forget to do the exercises, but now there is an app called the Squeezy app, which is very helpful to help us remember. I mentioned earlier that the genitourinary syndrome of menopause, due to atrophy, dryness and discomfort, can impair the pelvic floor muscles' ability to release and relax, leading to what is referred to as increased tone. This can lead to friction with the activities of daily living, such as walking and general movement, and often leads to sexual dysfunction. In this situation, a woman will be able to feel the muscle contract but unable to feel it relax at the end of that contraction. Guidance from a women's health physiotherapist, if you experience this, is advised. I would like to say a word in this next slide on bone health. Estrogen plays a very important role in keeping our bones healthy. The reduction of estrogen in menopause means that on average, women lose up to 10 to 30% of their bone mass in the first 5 years after menopause. And according to the Irish Osteoporosis Society, in Ireland, as many as 1 in 2 women over 50 will fracture a bone as a result of osteoporosis. Important points to remember in order to keep our bones healthy are avoiding alcohol, quitting smoking, and ensuring a healthy diet with recommended amounts of calcium and in particular vitamin D. Vitamin D is produced naturally within the body when the skin is exposed to sunshine. Unfortunately, in the northwest, we do not get enough sunshine on a daily basis throughout the year. Therefore, supplements are recommended, particularly through the months September to March. Physical exercise is of crucial importance when it comes to bone health. It is known that physical exercise has a protective effect on our bones and on our health in general. In fact, the World Health Organization in 2020 recommended 150 to 300 minutes of moderate intensity aerobic exercise per week. This is the same as at least 30 minutes of exercise 5 times per week. It also recommends regular muscle strength training twice per week involving light weights or body weight. Just a word on high impact exercise. A study by NAGARD in 2016 showed a higher incidence of urinary incontinence with high impact exercise, example trampolining, volleyball, running. Physiotherapists tend to advocate more pelvic floor friendly exercise such as walking, swimming, Pilates, yoga, cycling, light weights, all of which can be performed at a high intensity. We all know the cardiac and muscle benefits of exercise. It also improves our mood, reduces stress, and helps us to sleep better, all of which ultimately lessens the impact of menopause and the changes it brings. I hope this presentation has helped to provide you with some ideas on how to manage some of the menopausal symptoms you may be experiencing. However, it's important not to suffer in silence. If you experience symptoms discussed in this presentation and you are having difficulty managing them, make sure to ask your GP to refer you to a women's health physiotherapist for treatment. These are some resources which you may find useful. Thank you for listening.